On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Vivekanand to discuss what everyone should know about common allergies. Together, we will explore the causes, the symptoms, and the treatments for allergies that impact so many of us. Join us as we break it all down and welcome Dr. Callan to the show. Dr. Callan, thank you so much for coming here today.
Thank you. I'm glad to be here.
So tell me a little bit about yourself. Where you're from, what do you do?
Yeah. I'm from India. I grew up in South India where I did all my schooling. I went to Armed Forces Medical College in Pune, which is in the middle of, like near Bombay, or Mumbai as it is called now. And then I served in the Armed Forces for many years, and then I came over here to the US. I did my residency in internal medicine, and then I got exposed to allergy through some of the lectures we've had from the university. So I joined Downstate Allergy Immunology Fellowship because I was very fascinated by this field.
So you're certified in internal medicine, you're an internist,
Right.
with a specific subspecialty in allergy immunology.
Allergy immunology is one of those more unique fellowships which are one of the few specialties, I would say, where you see both adults and children. So we have cross-training during our fellowship to see both adults and children. I don't do primary pediatrics, obviously, because I'm not a pediatrician, but I do see children with allergy problems because I've had training in that.
So you see children, you see adults. Tell me, how did you get interested in this field?
The reason is I myself have bad asthma as a child, and then that's how I got interested in allergies, because allergies, asthma, they all, the birds of the same feather. They go together.
So there's a crossover between allergies and the development of asthma, or is it people who have asthma tend to have a lot of allergies? What's the association?
Yeah, very interesting question, because all the air that you breathe is through your nose. So if you have a nasal issue that blocking your nose, or you have a lot of allergy inflammation in the nose, it translates downstairs, going into the lung. Although we have subspecialties that deal only with the nose and only with the lung, the body doesn't really see them as separate entities. If one is affected, more likely, people who have nasal allergies are 3 times as more likely to get asthma as people who don't have any nasal allergies. So they're all linked together.
So if somebody has asthma, should they also be seeing an allergist? And if they have a lot of allergies, should they be seeing a pulmonary specialist see if they're going to develop I'm not sure I understand the association between the two.
See, the asthma is partly because you can do 2 different things. There is a variety of asthma that is allergic. At least 70 to 80% of asthma in children is mostly due to allergic causes. And then there is about 50 to 60% in adults is allergic causes. There are other sub-varieties of asthma that don't have relationship to allergy, but I won't go into that today. Mm-hmm. But the specialties of pulmonary allergy can be complementary to each other. We can assist each other in taking care of the asthmatic patient as a whole, because I can explore the allergies and then they can do the other part. If somebody has a structural problem, if somebody is admitted to the ICU or something, a pulmonologist is probably better qualified than me to take care of them.
So let me back up a little bit. What specifically are allergies?
Allergies are nothing but an abnormal reaction to the environment that we live in. For example, to the pollen, to tree pollen, grass pollen, to the dust, pet dander, things like that, which you are supposed to live in harmony. But we have a genetic basis. We inherit some genes from the parents, and then that makes us react to these things and then get allergies. It's an abnormal reaction to the environment.
So this is in our genes?
Yes.
So another thing we can blame our parents for?
Absolutely, yes. We can blame them for everything.
Always blaming the parents for something, right? We could talk about psychiatry some other time. But so I understand, I wake up in the spring and I see the beautiful daffodils and the grass is growing and the beautiful flowers, and I have hay fever, right? Is that allergic?
Absolutely. Hay fever is one of the earliest described things about allergy, and from there we started progressing almost very rapidly. All this progress actually in allergy immunology took place round about the 80s. Unfortunately, the AIDS epidemic actually triggered the research that we were doing in immunology, so that we understand allergies a lot more now than we did in the 60s and 70s. In fact, the antibody to allergy was discovered as late as 1960. Until that time, they didn't really know what the thing was causing the allergy.
So how do you diagnose allergies? Again, I understand if I'm going near flowers or a cat or my dog, if I start sneezing, I'm assuming that's allergies?
Absolutely.
Is there a diagnosis? Is
Yes.
there a blood test? What do I do?
Okay, most people think that when you want to diagnose something, you got to have a test. The most important test for allergy is actually history. If somebody says I'm having sneezing, itchy eyes, itchy nose when I'm with my pet, I don't need a test to tell me that he's allergic to the pet. I mean, you can always do the test and confirm it just to show people, because people are fascinated by tests. So, and another thing a lot of patients ask me is, I want to get tested for everything.
Right.
It's not like a thing that you go get tested. The tests in allergy are very different from the normal tests. I'm glad you brought this up, because let's say somebody gets an X-ray and they see a pneumonia. They can say, oh, yeah, you got pneumonia. If an allergy test is positive, it doesn't mean you have the allergy. You just all your body is telling you is, I recognize this particular thing because it's not part of my body. The immune system actually developed to protect us from the bad things in the environment, like for example infections and stuff like that. So anything that you inhale or ingest or eat, your body immediately puts a stamp on it and says, okay, I know this one. Okay. So when you do an allergy test, all it is telling you is, I know what this is. For example, if we both keep meeting each other on the subway, I never talk to you, but if somebody shows me a picture, I say, yeah, I know this man.
So the
that's
allergy test that you're talking about, is it a blood test? Is it a skin test? Well, what do you do if if you as an allergist want to do a test?
Okay, most allergists prefer to do skin testing. There are very few conditions where you don't do skin testing. One of them is if you have extensive skin disease where you don't have much of a space, you don't do it. Sometimes in very, very young infants, the skin testing may or may not be that reliable. That's also another problem. The third thing is what we call as a dermatographism, which means it's basically a sensitive skin. I can just stroke your skin with a pencil or pen or something, and then it flares up as a rash. So in that kind of situation, the skin is too sensitive. No matter what I put on the skin, it's going to become positive. So barring these conditions, skin testing is preferable because it gives you immediate results, and it also kind of gives me an idea how your body is reacting to it, if you have a very large reaction or a very tiny reaction. Whereas a blood test, although it's kind of specific, it doesn't give you that clinical information that you need. There are some tests that you need to do as a blood test to get some numbers and things like that if you want to do some challenges and things like that. There are specific criteria for doing this, but preferably should be doing skin tests.
So you mentioned environment. So the environment would be the air we breathe in, the grass around us, the pollen from the flowers, the grass, etc. I mentioned the dogs and cats. I'm a big animal lover,
yes.
And I know I've been allergic to many of the animals that I've kept for years, but I'm not getting rid of them. Let's talk about food allergies.
Right.
Are there foods that we're allergic to that we should stay away from?
Unless you have a problem with a certain food. Let's say you come and tell me, I want to be tested for foods. The first question I'm going to ask is, what happens when you eat a certain food? If you say, nothing happens to me, I'm not going to test you for it, because you already told me that you're not allergic to it. When you eat something, if you're allergic, something will happen to you. Okay. So doing a blanket test, especially for foods, because there are a lot of false positives. If I take 10 people on the street without knowing anything about them and do food tests, 10, 20 will come positive. It's never a good idea to do food tests unless somebody has a problem with that particular food.
So if I have a problem with a particular food, what would be the most common thing that would happen?
Okay,
would it be a rash? Would I have trouble breathing? What's the most common?
Okay, the most common thing that can happen with a food allergy is you could get hives, you could have a respiratory difficulty like difficulty breathing or swallowing, or the most severe reaction would be what we call anaphylaxis, which is like almost collapsing. So anaphylaxis is the most serious reaction that can happen either with a food or medication or something like that. So in such situations, we can find out if it is an acute reaction. Let's say if somebody is allergic to peanut or shellfish, which are two most common, peanuts in children, shellfish in adults. They eat it, within a couple of hours they will have a reaction. The faster you have the reaction, the more serious it's likely to be. If you eat, let's say, peanut today and then on Friday evening or something you have a little rash here and there, it's very unlikely that it's peanut allergy. And if you are able to eat it one day and then have some hives, but not another day, that also, it has to be consistently reactionable. You understand? So
And
some people tell me, oh, sometimes I can eat it, sometimes I don't eat it. Excepting very rare circumstances, food will consistently give you the reaction every time you eat it. Because
And I've always been told that it gets worse the more often you eat it. Is that true?
it is also true. It's like challenging your immune system every time you eat it. So you develop more and more and more. It's like vaccine, you know. You give booster doses, you do this so that your immune response is tighter and tighter and, you know, better. So each time you eat it, sometime maybe you can have a bad reaction next time.
Interesting. So I've heard that the incidence of allergies, both environmental as well as food allergies, has gotten higher and higher and higher. More and more people
That's right.
have allergies.
Right.
That is true?
Yes, it is true.
Why is
For
that? Do we
many
know?
reasons. One is we are able to recognize these allergies much better now because our knowledge has improved. As for a lot of times people used to ignore them before. In the 60s and 50s and all that, it was not such a major this thing. We didn't have much knowledge about allergies, so we never really bothered to find out. Now that we have so much information about how allergies are caused, what are the different types of allergies and all these things, we are able to diagnose them much better. And also through the public also has gotten a lot of information, sometimes wrong information, of course, from Google, which many people use. So you got to go to selective good websites like the American College of Allergy or American Academy of Allergy if you really want to know more about allergies. If you want to know about food allergies, you can go to foodallergy.org, which gives you all different kinds of information, how to identify what to look for when you look at a label and all those things. It's very, very good websites.
Or, as I always say, if you have a question, ask your primary care doctor.
Oh, absolutely.
You know, this is something that primary care doctors should be able to answer, correct?
Primary care doctors should be able to answer it, but unfortunately, the way the education is structured, most allergists are not in the hospitals. They are all in the community. So in the university programs and things like that, there aren't that many programs that have allergy education, which is part of the this thing. In fact, the ACGME has no allergy requirement.
ACGME is the graduate
medical education has no requirement for allergy as an special. You can't go through, let's say, medicine or pediatric without doing cardiology or GI or something like that. But there is no such requirement for allergy. So hospitals are not really interested.
So if I think I have an allergy, should I make an appointment with an allergist? Should I
No,
just
most
Google?
primary care people should be able to have some kind of interaction because they may take an elective and so there are people who come and give lectures and things like that, and but they very often see these things. About 20 to 25% of your primary care practice is going to be allergies, asthma, and things like that. Eczema, especially for pediatricians. So the people tend to learn about some of these things, either from an allergist or from their referrals or whatever. But the basic knowledge a lot of people have, with hay fever and asthma, they are able to do it. The question is how to refer, how to do this. They need to be educated on it every now and then.
So So of course we have to talk about treatment. I see a ton of commercials.
Right.
It seems like everything on television is trying to get me to
Do
go
something.
to my local pharmacy and buy something over the counter. Can you talk a little bit about treatment? If I think I have
Yeah.
allergies, should I just treat
Yeah,
myself?
if you have very mild allergies, you can use what we call over-the-counter antihistamines, like say for example Claritin, Allegra, cetirizine. These are all second-generation antihistamines that are less sedating. Cetirizine could be a little bit more sedating, but generally are classified as less sedating. That can be used. They work 24 hours, and then they give you good relief rather than popping, the first generation like Benadryl every 6 hours. Not that Benadryl is a bad one. Benadryl is a great medication. There is nothing wrong with it. So the other thing is, if you are mild allergy, you probably get rid of it with just taking an antihistamine as you need it. When you start having more and more severe allergies, antihistamine alone may not be sufficient to take care of your allergies. That's why a lot of people tell me, oh, I tried this antihistamine, that, and none of them worked for me. They stopped working for me. I don't think they are working. It's not the antihistamine is not working. The amount of load that they have about allergies, antihistamine is not sufficient by itself to take care of the problem. They need additional medication, for example, a topical nasal spray like a steroid spray, which will help them control the inflammation. Same thing for asthma. If you have asthma once in a while for a day or two, you can use albuterol and forget about it. But if you are having asthma more regularly or more severe varieties of asthma, you're saying, oh, albuterol doesn't work for me, is not a good answer, because it's not enough. You need to have additional medications like topical steroids, etc., that you inhale. You keep you under good control.
So can you explain in layman's terms,
Right.
what is an antihistamine?
Antihistamine, when you have an allergic reaction, what happens is, let's say any tree pollen, pet dander, food, whatever it is, it sticks to your cells called mast cells that liberate large quantities of histamine. Depending on the severity of the reaction, you could have a very serious reaction, or you could just have a local reaction like hay fever, or you could have asthma and things like that. So antihistamines basically are antagonizing histamine that is liberated when you have an allergic reaction. Most of the time antihistamines are most useful if you have nasal allergy, or if you have a hives or something, mild rash that is not more serious, that part of it will control. But if you have more severe allergy, when you have inflammation, it's not going to be able to do that job.
So the
It's
level
not
of the histamine is
it's
related
just an
to-
antihistamine.
So it's bringing it down.
It's bringing it down, or it is antagonizing it actually.
Right.
It's not bringing it down. If the allergic reaction keeps continuing, it's not going to bring it down. It's just like a brake. It's like a brake in the car. As long as your foot is on the brake, you're okay. The moment you remove the foot, the car will start moving.
So this sounds very complicated, and it doesn't sound like something I should be treating myself. Can I make an appointment to an allergist directly, or do I have to call my primary care doctor first?
It's always better to have a primary care doctor who will coordinate your care along with the allergist and other specialists, because most people generally, they have more than one issue, and it's better to have a primary care doctor who will coordinate the thing. Because as an allergist, if somebody refers to me for a nasal allergy, I'm not looking at the rest of the problem. That's not the thing I'm required to do. So I treat the allergies, but I tell them always have a primary care who will treat you the rest, all of the things that you have.
So once again, we're talking about the importance of staying healthy.
Oh,
And when
absolutely.
you're not healthy, using that team
That's right,
approach,
yes.
making sure that you're seeing a primary care
Primary
doctor.
care doctor is
and
very
then
important in this whole
And bringing
field.
the specialists
Bringing
when
in
it's
the
necessary.
specialties as needed, and then coordinating the care.
So let me see if I can summarize what I've heard is more and more people are getting allergies.
Yes.
There isn't a specific test for allergies other than sitting down with somebody as knowledgeable as you and going through a list of saying, okay, when I eat this food, this is what happens. When I'm in this area, this is what happens. So I'm with the daffodils and I can't stop sneezing. That's probably means I'm allergic to the daffodils?
Yeah, but I wouldn't say there is no test for allergy. I would say the test has to be appropriate for the type of problem that people have. If somebody says I have hay fever when I'm in the springtime, I'm not going to test them for food allergies unless they also have a food problem.
I see. Okay.
So it depends on the problem that person has. It's not like you come and say, oh, I want to be tested for everything. It doesn't really mean anything to be tested for everything. You have to test in the context of the problem that you have. Tests are available for everything. But if you don't use the right test, you may not get that information. It's going to be a waste of time and energy for the patient.
That makes sense. And the test is a skin test, you
It
said.
can be a skin test or it can be a blood test.
Or blood test. When do you do the skin test? When do you do the blood
When
test?
I'm unable to do skin testing, let's say the patient is very uncooperative, or the patient has a skin disease that I don't have enough space for to do the skin test, or if they have a sensitive skin that no matter what you use, you start having hives and things like that. Those are all not conditions where you should be doing skin testing. Then I would go for a blood test. But there are certain situations where in addition to skin testing, I would also do a blood test. Let's say, for example, somebody has egg allergy. I will do a skin test. I find out, okay, when they eat egg, they have an allergic reaction. And then I'm also going to do a blood test to get a specific number on this thing. So for certain allergens, we have a number that, so after every year, I'm going to, or 1 or 2 years or 3 years later, I'm going to repeat the test. When the numbers start coming down, at a certain point in time, I say, okay, it is probably safer to challenge the person now than before. If a number is very high, there is a 95% chance that the person is going to have a reaction. I am not going to do the challenge, because the gold standard for food allergy is challenge. I don't tell anybody to challenge the food unless you know what you're doing. It's a very strange and dangerous test.
And a challenge means I eat that food?
Yes, absolutely.
Wow. Even though you know I'm allergic to that food, I'm
No,
going to eat it?
that's why you need to follow, because there are certain allergies that you outgrow. There are certain that you don't outgrow. For example, peanuts, shellfish, you are allergic for life, unfortunately. Very small chances, like probably 20% or less, that you will really outgrow them. But say things like milk, eggs and things like that, by the time somebody is 8, 10, maybe even up to 16 years old, they can outgrow them. There are some that you outgrow faster. There are certain situations which is hard to explain that will indicate to me that yes, the person is ready for challenge.
And you mentioned difficulty breathing, you mentioned hives and skin rashes.
Right.
Those are 2 signs that I might be allergic? Are there others that I should worry about?
There are others that you are allergic, but the test that I'm doing will bring in only the type 1. It's called a type 1 or an anaphylactic type of reaction. Hives, asthma type of reaction, or collapse. These are all called type 1 reactions. When you do skin testing, you are testing for these. Somebody says, oh, I'm having stomach upset. By doing a test, I can't tell whether the person is having a stomach upset or not, because the test is not meant to detect that problem. So if they have a stomach upset, my test is not going to be effective in doing that test. So sometimes it's hard to explain to patients, you're having a stomach upset. That has nothing to do with the kind of test that I'm doing. They don't understand.
And could a stomach upset be a sign of an allergy?
It could be a sign of allergy, because sometimes there are conditions like, eosinophilic esophagitis, eosinophilic gastritis and things like that are new, but many patients, let's say they have irritable bowel syndrome or something like that, they may not be able to tolerate certain types of foods and they may give them diarrhea. Another common problem is, let's say, lactose intolerance. People think it's an allergy, it's not. It's because of a deficiency of an enzyme, you are not able to tolerate milk.
But
so you can have lactose-free milk,
right,
but not lactose milk.
So that's not an example.
That's not an allergy.
Fascinating.
It's like the same thing with that. Sometimes, oh, I'm allergic to aspirin. I said, what happened to you? Oh, I had a stomach bleeding. Mm-hmm. That's not an allergy. It's a side effect of the medication. If you had hives or if you had an asthma attack after taking aspirin, then that's an allergy.
Fascinating. This is wonderful. Thank you so much for what you do, and thank you so much for being on the show tonight.
Sure. I think we should do some more of these on specific topics in the future.
This is great. Thank you. That brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, visit www.zurmed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals South Brooklyn Health. Until next time, be safe and stay well.